This video demonstrates how to perform Labmaster LUCIA SARS-CoV-2 IgG RBD test. LUCIA SARS-CoV-2 IgG RBD test is an in vitro near-patient diagnostic test for qualitative detection of the presence of SARS-CoV-2 receptor binding domain IgG antibodies from whole blood. SARS-CoV-2 IgG RBD kit contains components for 40 tests. Before measurements, verify that the NFC card and used components have the same batch information. Place plungers inside one 7 microliter capillary tube with blue marking. Fill the capillary with whole blood sample up to the white stopper. Ensure that there are no air bubbles in the capillary. Dispense the sample into a sample dilution tube. Close the cap and gently mix the sample by inverting the tube at least 5 times. Take out the cassette from its pouch. Insert patient ID. Read the NFC card and place the cassette onto the tray. Fill the transfer pipette with the diluted sample by squeezing and releasing the top bulb. Apply 1 drop of the sample into the sample application hole of the cassette without touching the membrane and release the top bulb entirely. Then touch the membrane with the tip of the pipette. Start the measurement by pressing the accept icon. Measurement time for the test is 6 minutes. Once the measurement is finished, the test result is shown on the screen and the user is prompted to remove the cassette from the analyzer. Place the NFC card back in the same test kit box for further use. Please note, use the same card for all the tests in the kit. Summary: verify that used components correspond to NFC card batch information. Prepare capillary. Collect sample. Add sample to dilution tube. Mix by inverting the tube 5 times. Open cassette pouch. Insert patient ID. Read NFC card. Place cassette onto the tray. Fill transfer pipette with diluted sample. Apply sample. Press accept icon.